So, good evening, everyone. It's very good to see you all. Thank you for surviving till the evening. I think we should have made it really clear that wine will be served after this session. I don't think it was very clear in the agenda. But this is a very special moment for us because we're coming to the end of a very long process. And our main aim has always been that the world of work, workers, the labor sector, including employers and governments and ministries of labor, have a crucial role to play in the sound management of chemicals. And throughout this process of nearly 5 years, working together to rethink and reorganize what a new global framework for the sound management of chemicals and waste looks like, we hope we've been able to include the voice of workers properly and the voice of ministries of labor. Unfortunately, we continue to see that there are still problems, there are still gaps, and the world of work is not necessarily accepted as a leading partner in this process, rather than just someone that we need to negotiate and bring along. Moving back just a little bit to introduce myself, for those of you who don't know me, I am Manal Esdi. I'm the team lead on occupational safety and health based in the International Labour Organization in Geneva. And I'm joined here by many panelists today. We'll start with the two colleagues on my right and left side, but then we're moving on to another panel as well. So what I wanted to say really is that this is just the beginning of a new framework, but the real work lies ahead. So we need to be joining efforts to implement whatever framework we're going to adopt and to live by the high-level words of a declaration that will be adopted in a couple of days. And we have clearly seen that without collaboration between ministries of health, labor, and environment, the changes that we hope to accomplish will not happen. And looking 20 years back on SciChem, we also have seen that there have been lots of lack of accomplishment of a lot of the things we plan to set out to do because of the lack of collaboration, because of the lack of representation, because of the lack of multi-sectoriality and multi-stakeholder, meaningful multi-stakeholder joint efforts. So we hope that this will be a new chapter. So this is how we hope to start this labor sector meeting, understanding what's at stake and understanding the role that we will each need to play moving forward. Without further ado, the first part of the panel, I would like to introduce our first speaker, Dr. Alexis Tecata from the International Commission on Occupational Health, ICO. Hopefully he will help us paint the picture of the current state of the evidence. I see there's a lot of numbers on these slides. To see the linkages between exposures and worker exposures globally due to chemicals, hazardous chemicals. The floor is yours.
Thank you, Nala, and thank you for inviting me to this session on behalf of the International Commission of Occupational Health. It's a real pleasure to be here, especially as a professor in occupational health and an emergency physician, and try to paint a picture. It's how to start, and I think start by some fact that everybody know but need to be reminded is we know that 1 billion workers are exposed and more than 1 million of workers killed every year due to hazardous chemical substance in the working environment. This is all what we know. And when you look at, I won't go through this whole table about the deaths provided by Yuka Takala here, is to say more than 1 million. And when you look at, there's many diseases there, mostly respiratory disease, both acute and chronic disorders, but also almost 500,000 deaths from cancer, which have long delay of onset. And when you look at not only deaths, but what we call DALI for disability adjusted life years, 1 year with poor health, you can see that the global burden of disease related to chemical health for workers are huge as well, with over than 80 million disability years daily calculated recently. And of course, there are impact of health, but also on cost. And that's why we need to say to stakeholders as well that it's not only a cost for people, but also for economy with 2.1% of the global product. What kind of hazard are we talking behind this death and disability? The next concern, and here it's you can have the full report because WHO and ILO made a joint estimate in 2 years ago, where we can have trends from 2000 to 2016, where this come from. And here you have the total number of attributable deaths by occupational risk factors in more than 180 countries all over the world. What is the first one? Here you can see that occupational
in collaboration with employees and with workers organizations, all of them should and have to promote respect and realize in good faith the principles contained in these two conventions. It is quite important that these were the two conventions adopted as fundamental because they have something of critical importance once again. What they say is that in every single member state, we should have a universal national policy for occupational safety and health, which encompasses all occupational hazards. It should apply to all sectors and to all groups of workers. This policy should be complemented by a national program or strategy, as we call it in some countries, which should also be universal in scope. And furthermore, action also has to be undertaken at the workplace level, mainly in terms of ensuring that all work is safe and without unprotected risks to the health of workers, including in relation to exposure to chemical hazards. So this is what I just mentioned about the two fundamental conventions. You'll find already a set of publications online if you go to the website of the ILO, where you can find more references on the content of the conventions. Why is it really so important that these conventions are now fundamental? You also see a reference that, especially for those of us that work with occupational safety and health, that our concept, our understanding of OSH is that, again, OSH also encompasses all labor rights and all working conditions. Of course, we cannot think that when considering safety or health issues in any workplace, that we should look into working hours, for example, into work organization, and all that relates to mental health problems, because this again, may also have an effect on the exposure of workers, to a probability of having a negative impact on their health. Maybe, for example, of course, if a worker is tired because he has been working excessive hours, of course, that the probability of this worker, paying less attention to what he's doing, mainly with chemicals, will be much higher. So this is also why for us it's important to reaffirm, every single time that we speak of OSH as fundamental, that OSH has a relation with all working conditions and with all labor rights, including a fundamental right, also very important for the ILO, which is the right of freedom of association and collective bargaining. And this is also why for us it's very important, and we have seen this throughout all that the ILO has been doing, in the cycling process and in other fora as well, is that we always bring the tripartite constituents on board. We always bring the governments, the employees organizations and workers organizations, because this is the voice of the world of work, and it's only by their collective action that successful efforts will be achieved successful results will be achieved in any country. So, as I mentioned, we have a very specific convention focusing on chemical hazards. Unfortunately, this convention, up to today, was only ratified by 23 of our member states. So, a very low level of ratification. A pledge to all of you help us to work with our member states so that they ratify this convention. The ratification of this convention is a powerful ally, a powerful tool for the implementation of any non-binding instrument that will be adopted here, as an outcome of all of this process and the works of this week. Similarly, we have a convention which, of course, has it's quite important when thinking of chemical hazards. Convention number 174 on the prevention of major industrial accidents. Again, as you see there, only 19 member states have so far ratified this convention. Again, a pledge to all of you, help us, to work with member states to prepare for ratification of these conventions. I just, I know that I don't have much time to speak. But I just wanted to bring you one slide with a very, very short description of the content of Convention number 170. To all of you that have been working, with chemical safety, throughout the years, so that you can see why is it so important that a reference to Convention number 170, in addition to the two ILO fundamental conventions on knowledge, will be so relevant to keep in any, again, statement, declaration, text, even if not binding. Why? Because if you see what's there on the slide, Convention number 170, in a way, deals with almost all aspects related to the international safety of chemicals. So it's not only at workplace level, because you see there that the convention, the standard has provisions. Again, that applies to all that is related to the production, the handling, the storage, the transport, the disposal of chemicals. There's also a very important reference to the prerogative or the duty of the national authority to identify prohibitions or restrictions to the use of hazardous substances, hazardous chemicals at work. The establishment of systems and criteria for the classification of all chemicals, labeling and marketing. Also, the need for namely producers to deliver chemical safety data sheets. Also, provisions for chemicals not being used in workplaces if the chemical safety data sheets are not available and known and informed to the workers. And also all that relates to responsibilities of the supplier to classify, to label, to provide these sheets. And including, if you read, if I can stimulate your curiosity, and you will read the text of the convention, you will also see that there's a very specific provision at the end, which really deals with obligations of countries or member states when exporting chemicals to outside of their national jurisdiction. So I'm not going to spend time on the wealth of publications that the ILO has also available on the website. On chemical hazards, they go through research reports, planning materials, awareness raising and education tools. Again, all of this is there. What I would just like to say before I end this presentation in 30 seconds is that, again, the ILO is currently renewing or starting the process of renewing its own normative framework on chemical hazards. So this is a process that will start, not yet confirmed, but possibly in 25 or 2026. So we want to complement and update in a way the provisions of Convention number 170 and the very old instruments that we have already dating back from 1919 on chemical hazards. And also we are now preparing, and hopefully this will be adopted in November this year, a new global strategy on occupational safety and health and the new plan of action, where we have already included or proposed to include a possible roadmap on sound management of chemicals and waste, as well in the follow-up, the decisions to be made this week. And again, we are there to work with you, and we also hope that you can support our work. And thank you.
Thank you so much, Joachim. Thank you, Alexis. Thank you, Joachim. If I may ask you, so I can ask our panelists. I won't waste any more time in introducing our four panelists. To join me, please, on the podium. We have with us Mr. Rory O'Neill, the chemicals experts from the International Trade Union Confederation, Mr. Shoshiro Yasui, Director of the Chemical Hazard Control Division, Department of OSH in the Ministry of Health, Labor and Welfare of Japan, and Ms. Elisa Eupola, Chief Policy Advisor, Chemical Industry Federation of Finland, and Ms. Christiane Rohleder, State Secretary from the Federal Ministry of the Environment, Nature Conservation, Nuclear Safety and Consumer Protection. If I may, and before I turn to the panelists, I'd like to also mention that we have a number of ministries and other employees and workers represented with us also in the room and in the different sessions of this conference. Another welcome to Mr. David Chaita from Argentina. Thanks for joining us. We were not able to have everyone on the panel, especially governments, as we have a limitation on how many governments can be on one panel as to our ILO rules. Sorry for that. And we're very happy to have with us Mr. Musa Nyandusi from Kenya. Thank you so much. You've been very helpful and contributed a lot throughout the various sessions. So we'll be happy to hear in the questions and answers your input and experiences from your national context. That would be great. Mr. Venura Perez from Sri Lanka and Ms. Millicent Abigail Rutis from South Africa. Thank you for also joining us. And from Jordan, Ms. Najah Mahmoud Hussein Abu Tafish. And I'm also happy to see among us somebody who was critical in the process of raising the voice of workers throughout this process in the past 6-7 years and more, and making it part of his mandate to make sure workers and the world of work have a crucial role to play in sound management of chemicals. Mr. Bashkut Tunjak, who was the ex-toxics rapporteur on human rights and who's with us in the meeting. Thanks for joining us. And also please feel free to make any comments, because we don't have the voice of the human rights perspectives with us today when we open the floor for questions. So I turn first to Rory O'Neill, because he's very much wanted in 3-4 different parallel sessions. So he may have to leave us before we finish. Rory, nice to meet you. So this is it. It's happening. This is the final week where we will finally, hopefully, go home adopting a new framework that has potentially learned from past experiences moving forward. I want to ask you, as a person who represents 200 million workers, as you often say, what does the Bonn Declaration or this new framework mean for workers' organizations? And what would you say are the needs and priorities for workers as we move towards implementing this new declaration and framework?
Thank you, Manal. Thank you for inviting me to this meeting. A couple of things I should clear up. I can refer to me as a chemical expert. I'd rather refer to myself as a recovering chemist, not particularly expert. And I'll tell you the reason why. I once believed that I knew a lot about chemicals, and then 200 million workers taught me lessons in humility every time I went near a workplace, because the expertise is in the workplace. If you're not listening to those workers, then you know nothing about chemicals. Okay, so in terms of the theme of this meeting, how we're going to make things change, well, I think we've exhausted every fact related to occupational health and chemicals and standards and things between Joachim and Alexis, so I'll not go down that avenue. So I'll go back to the basics. We're discussing here the context in which we use chemicals around the world. So there's two things I'd like to look at. People say in these meetings all the time that stuff kills you. It's benzene, it's asbestos, it's silica, it's whatever else. That's one thing that we say. And then the second thing they say, that knowledge saves. If only we had the information, things would be better and the world would be a safer place. And I would say that this meeting, if it believes either of those things, is going to achieve absolutely nothing. It's not stuff that kills. It's decisions about how it's used, when it's used, and who has the power to say no to the use of it. I'll give you examples. There is no secret about silica killing. It's been killing people, and it's been known to kill people since antiquity. There's no secret that asbestos kills. Pliny the Younger was reporting asbestos risk around the time that Pompeii was covered. and that tragedy occurred there. Absolutely no mystery. Yet, at the Rotterdam Convention, we can't get asbestos listed for prior informed consent, so that people can export it. They can do it freely without putting a health warning on their products. On silica, instead of going down, the disease known since antiquity, a disease that was associated with miners in the days of Victor Hugo and things of that sort, you know, of the dark industrial past, not going down, it's returning. We're seeing people dying younger and faster from silica diseases in different industries because people are making decisions, not because they didn't know, but because people are making decisions. In the mining industry, we're seeing people dying at 20, 25, 30 from silica-related disease. That never happened in the grim old days. You lived a horrible life and your dailies were affected, your quality of life years were lost, but you didn't die in your 20s or 30s or need a lung transplant. And it's happening now for economic reasons. People are making decisions to mine thin coal seams, so most of what gets mined is not the coal, but the silica that's around it. And even though we have all the science, even though we can land on the dark side of the moon, even though we can go to Mars, we've still got people breathing at us down mines. So that means it's about decisions. We see this all the time. So those are two things. So it's not knowledge and it's not stuff. It's decisions about what we use, where we use it and how we use it, and where the power lays to say no. So that's how we come to this agreement. Now, will this agreement work? Will one declaration work? Well, the answer to that is, well, it depends. It depends what it says. We had no language to speak of on labour in this document when we started this process. We were the sort of poor cousin to the environment. It was an environment agenda, and we would go to meetings and people would say, yes, of course we understand labour, of course workers must be expected, of course they have the higher exposure. And bear in mind that that figure on environmental versus workplace exposure has been 100 times more. Well, we go home to the environment as well. It doesn't switch off when we leave the factory. We get both sides of the factory fence. So we get that sort of thing affecting itself. But in truth, that doesn't translate to the language, because this is a process at the moment dominated by environment, and they go native when it comes to their safe place on the setting language. So we here, the labour constituency, be it governments, be it unions, be it employers, have got to make this about us too. We have an expression in the trade union movement, nothing about us without us. Well, this is about us and without us. It's not the right way to go about it. And we have to assert ourselves in the room, make sure that doesn't happen. So we have tried to put language in this agreement that actually reflects better the needs of the workers, the needs of working people and their families and their communities. There should be information on procurement, so decisions about what we buy and what we use are based around what is safe and what is good for the environment and for safe and sustainable jobs. We need information on just transition, because a choice between poverty and poison is no choice at all. We need to take people from the jobs they do now, which are dangerous and dirty, on a safe journey through retraining and through public investment and through investment by industry to take them to doing safe, sustainable and decent work. And that's the model that was being presented by Joachim earlier on when he was talking about fundamental rights. It's all about the package of decency that we live our working lives in. We need due diligence so that employers in the major companies can't observe the standards only on their own doorstep and only in their own country, but they have to observe them down through their supply chain and then over into their practices when they're overseas. Because we have many products, like one in Britain, produced by a chemical company, Paraquat, can't sell it in it's 11 miles down my road where they make it. They can't sell it to me. Yet they sell it to India, where people die in their thousands, not just from pesticide exposures, but because they die from suicide because of being given access to means. So you combine poverty and hardship with access to a poison, and what do you get? You get tragedy, and that shouldn't be allowed. We need fundamental safety, as Joachim said, and we need duties and rights, so that working people who know the risks can actually do something about it. Because let me tell you, information never saved anyone's life. Information is information. Power is power. Information is never power. So we need the rights to refuse dangerous work, we need the right to information, we need the rights to act. And this is why the model and why the mention of Bashko is so important. Occupational health and safety is a human rights issue. If we don't frame it as a human right, then we're not recognising that every part of your life, from how secure your employment is, to your rights to say no, to your right to decent wage, so you don't have to fight in horrible conditions for low wages and accept abuse, all those things are put on the sidelines. So it's the big picture, it's a human right, workers' rights are human rights. Okay.
Thank you so much, Rory. I hope that our actions will match your passion. And I made a strategic decision, a strategic mistake by seating the State Secretary of the Ministry of Environment right next to you. Or maybe not a mistake. So hopefully we can come out of this with a clear understanding that we do need to do better at the national level in working together between our labor and environment and health and other sectors. Obviously, that's why we are here. Let me move directly to Mr. Shojiro Yasu, who will present a few slides on the national context on what has been your experience in managing chemicals in Japan and what has worked for you.
Sure.
Please go ahead.
Thank you, Madam Chair. My name is Shojiro from the Ministry of Health, Labor and Welfare Japan. So I'm trying to making an input from the government perspective. So yeah. So let me explain about the novel approach to the chemical hazard control. In Japan, now we are making a transition from a kind of old approach to the novel approach right now. So we'd like to share the lessons learned from these transitions. So let me explain about the background. So we have around 500 cases of work-related chemical accidents annually. And also chemical accidents occurs not only in the manufacturer. So the manufacturer is only 46%. We have construction 14 months and consumer service and cleaning others. So lots of industry was involved in the chemical accidents. So it is not a matter for the manufacturer only. Then also we have a big problem is there. 80% of chemical hazards accident are out of special regulation substance. That means we have 123 substances. So it has very specific regulations depending on the chemicals and substances. But these substances only occupied 80.5% of all of the chemical accidents. So that's why we need to reform the regulations. And also, the other issues, increasing the issue of the category 3 workplace, that means which needs immediate improvement working environment. This means actually it's bad environment, but it's now increasing like, special chemical related work environments. It is the special regulations have sense other than organic chemicals. It's only 1.2% in 1996, and now is 4.2% in 1919. So working environment is deteriorated right now. So we are now making reform and try to making a novel approach to chemical hazard control. So as I said before, this special regulation that provide very limited numbers of materials. So we have the product 8 substance for the prevent, produce, and use, like asbestos, and also highly hazardous 123 substances. It has special regulations. Therefore, we have 674 substances for the required SDS provision and also the risk assessment for use. But we have tens of thousands chemicals, and in that case, hazardous substances classified GHGs are there, and also there is some potential hazardous and substances a lot of there. So we try to cover all of these tens of thousands chemicals for one regulation. So depending on the amount of information, so we could identify 2,900 substances as classified as hazardous, based on our national GHS classification. And in that case, we obligate the employers following all substances classified and obligate to keep exposure as well as reasonably achievable and also keep exposure below the national concentration criteria if it is established. But the very important point is measures to achieve those goals are left to the employers. There is no specific regulations. So they are going to the risk assessment, and based on the risk assessment, they will choose what kind of risk reduction necessary and implement them. So we are called it as autonomous management. So we are trying to introduce this one. So the other than tens of thousands, other than 2,900, as we impose on the employers the duty of effort. That means they can do as much as possible, but it's not duty at all. So this is the structure approach for the chemical hazard control. Is it start, everybody have to start the initial investigations, identification of the hazards using by SDS information, as estimation of the exposure using a model or the area monitoring. Then risk identifications that any indoor and workplace exceed the concentration criteria. If say yes, you have to go to the monitoring and the personal exposure monitoring for the compliance of the criteria. And we have a question and exposure indoor workplace keep below concentration criteria. If no, we have to go to risk reduction. So we have some priority for primary is engineering control, secondary is administrative control, and tertiary is personal protective equipment. So according to following such kind of priority, they have to conduct the risk reduction. So after that, they are going to the exposure monitoring and also the question if the risk reduced a little bit, but still continuous monitoring is necessary. So you have to do the same thing until the risk reduction measures are unacceptable. You have to go on. So that's the system. And so also for the autonomous management, so establishment of the chemical hazard management system is very important. Also, human resource development for chemical hazard officers and experts are very necessary. So, employer is obligated to identify chemical substance control managers. So he is or she is responsible for identifying labeling SDS, risk assessment, and risk assessment measures, record keeping, training, and provision the SDS and emergency response. They are responsible, all of them. So also, in case the using the PPE for risk reduction, so employers identify the person in charge of their personal protective equipment, and they are responsible for selection and maintenance of PPE. So under this instruction, former instructed workers, so they are implementing the risk assessment measures in actual workplaces. Also, outside enterprises, consultation, advice, and instruction by qualified chemical monitoring expert is very important. So, and the national government making a qualification for these experts. So this is the system. And also, one more thing is the for the compliance. Under autonomous and management, so there is no specific standard. So it's a little bit difficult to instruct how to improve the situation of the chemical hazard. So in that case, if there is a workplace where accident occurred or highly probable, so regular inspection issued the instruction to move the chemical management. But it's after that, the workplace seek advice from qualified chemical experts to risk reduction measures, and based on the result of the risk assessment, then qualified chemical experts, and most of them are occupational hygienists, issue the written reports and of evaluation of the risk reduction, and also advice for design improvement. Then the workplace develop an improvement plan and report it to the inspection office and implement implementation plan. Then a labor office inspect regularly what kind of situation or status of the implementation. So this is the last slide today. So based on the lessons learned, we have find out the must items for National Chemical Hazardous Control Program. We have three important points. The first one is the provision of information on hazards. So everything was start from the information. But, you know, as information is information, but anyway, we need the information anyway. And also, and improved in-house management is necessary. So train in-house chemical management offices, and also a development and design this simple numerical model and risk assessment tools for chemicals. You know, IAO is providing control bonding. And also, Japanese government provided create simple. Also, EU provided some other tools, but such kind of tool is necessary. And also, develop an industry and work process specific manuals for risk assessment is especially necessary for the construction and tertiary industry because they are working different conditions every day. So it is very difficult to conduct full-scale risk assessment every day. So they need the simplified risk assessment specific for working process. So such kind of manual is necessary. So we are now developing them. And also the qualified expert resources, external resources, we qualify the chemical management expert and try to facilitate small and medium enterprise maybe to consist with an expert because they SME does not have enough in-house resources there, so they need to help from the external experts. And also, we need to clarify exposure monitoring agencies and occupational health service agencies because from the viewpoint of the quality control. So these are the must items we believe to implement the National Chemical Hazard Program. Probably all over the world. Thank you.
Thank you so much. That was very informative. Thank you so much. Information is not power, but information is a start. So this is a great example from Japan, a huge country, and it's integrated into a larger system, of course, but it's good to hear some detail on it. We have with us Ms. Eliza Irpola, Chief Policy Advisor from the Chemical Industry Federation of Finland. Welcome. I'm wondering if you can tell us a little bit about some of the lessons learned nationally for you around chemical management, but we want to make the most of your presence to hear sort of the employer's perspective on maybe implementing this new framework and then the bond declaration that will come out this week.
Thank you very much for inviting me here, and proud to be in this very good panel. My perspective here is the one from a highly regulated region. Finland is part of the EU, so we have many legislative instruments in place, including the REACH regulation and the Occupational Health regulation, which covers the exposure limits and all of these. So, of course, there's a strong regulatory background for the industry to achieve its targets. But my lessons learned, the first would be the safe operations, and that is through the risk assessment. I think that my colleague here just described the situation pretty nicely. We have very much the similar situation, and we are going through the risk assessment processes, starting with what you referred also safety databases and chemical classification and labeling. So you need very easy, just kind of they are elemental for safety of work, because it's kind of you cannot assess your raw materials, you cannot assess your conditions at work if you don't have information on the hazardousness of the chemicals and how to use them safely. And that's what safety data sheet is usually covering. Of course, the ILO has their chemical safety card, which is kind of responding to that need for those countries who don't have their own. But I guess that these two elements are. When you go beyond the risk assessment for the normal conditions where you reduce the exposure so that the working is safe. But then there might be incidents, small incidents or bigger accidents. And for those, you need what we call a safety culture, which is kind of, it's going through all your operations together with your workers, and you just try to identify every challenging point. And that's kind of where we see that the part of the workers is so crucial, because they are there in the working places and operations, and they also give you kind of that we find this not safe operations when if something happens, and then you just go through this. You make targets, you plan, and you take measures. And the most important thing is that you monitor how it's going to be, and it's a continuous process. You go around it. My second point is that you need to work together. You need to work together in-house. You need to work with the process safety. The worker safety part needs to be very closely with the process safety and with any part of your safe management is crucial, so that you can guarantee this. These are the top leadership issues, that the working is safe. So it's not a kind of so you have a certain part in the operations somewhere. These are the worker safety people, but it should be the responsibility of the higher management to be to have the safety at work. And then you need to work also with other companies. We have in our federation had the so-called what we call godfathering projects, so that bigger companies together with smaller member states, they kind of form these godfathering with companies, and they teach and go through the smaller companies' processes and advise when you can improve in safety, what are the challenges and how bigger companies have solved them. And we have done this region-wise or sector-wise, how does it fit to the operations. And of course, there have been so many cooperations with our authorities and institutes on training, and because as information is important, even though it's only information, but you need to be constantly training. There are new employers, people need repetition to have things in mind, so that's what we find so important. And the last, our lessons learned is that you need awareness raising, and these things must be on the agenda of the educational programs and kind of regionally, nationally, wherever. And I can see now that also internationally they need to be highly on the educational programs. And there's kind of no one size fits all. There are so different. I guess that not many of you need to think that what happens to your bowels in minus 25 degrees. So it's kind of, you need to adapt these things. And then you ask how we should, what is our role in the Bonn Declaration? And I think that our role as an employer is to guarantee the safe operations in our kind of activities. That's the main starting point. But of course, when I'm speaking to you as a representative of the chemical industry, I think that our role is to produce and manufacture chemicals that are safe in their applications. And another role is to convey the safety information and directions how to use the chemicals safely. And of course, the downstream user responsibility is then to read those and try to implement their conditions so that the use is safe. And of course, one of the main responsibilities for us is to be an active partner here in the international fora and in the SAICOM Beyond 2020 framework. Thank you.
Thank you so much for this useful perspective. I'll move to Ms. Christiane Roledler. State Secretary from the Federal Ministry of the Environment. Last but not least, from our panelists, we're happy to hear from you, knowing that we are today in this global platform and we're trying to promote and motivate for more multi-sectoriality and multi-stakeholder presence in this process and more coordination. We'd like to hear your perspectives on how the Ministries of Environment, Labour, and other ministries can work together, and maybe some practical advice from your experience on how such dialogue can actually be initiated and maintained for the sound management of chemicals.
Thank you very much for the kind introduction. Sustainable chemicals is a cross-sectoral challenge, as we already heard, and it requires coordination between different actors, and the environment and labor ministries have to work closely together in this field. And also was Rory O'Neill already showed very well how important it is to work together between the environmental and the working sector, and also was Elisa Ilpola said also shows that we have to know which challenges are very, very concrete at the working place, or also in a broader scale. And that's why I think it's essential to work together, not only between labor and environment. Also, we are also the Ministry for Consumer Protection, and this is also obviously very closely linked to chemical safety. And this coordination is also important to ensure consistency and leverage potential synergies. And I see three most important areas for coordinated action between environmental and labor industries. First is promoting implementation of international conventions on chemicals and waste, which are, for example, the Rotterdam Convention on Trade in Hazardous Chemicals and Pesticides, the Basel Convention, and the Stockholm Convention. These conventions all aim to protect human health and the environment at once, and also labor and the safety for workers. Second is promoting the sustainable production and use of chemicals in line with the Sustainable Development Goals of the 2013 Agenda. This means minimizing the negative effects of chemicals on the environment and on human health. And the third field is improving health and safety for workers who come into contact with or are exposed to chemicals. This requires preventive measures such as substituting hazardous chemicals with less hazardous or non-hazardous alternatives, and providing personal protective equipment, conducting risk assessments and training of workers. And the ILO here has issued several standards and guidelines to protect workers from chemicals, which have to be implemented. And I think this is a very, very important work. So thank you for that. And I also want to say a little bit in the also agreeing with what Rory O'Neill already said, that it's all about decisions. Information is not enough. We really need protecting decisions. We need the information first, because it's the basis of to make the decisions. But there are some chemicals that are so hazardous that it's not enough only to inform or to give personal protective equipment. That we need safe alternatives, and we also need bans on certain substances like asbestos. It's obvious. Sustainable chemicals management also includes keeping. It's also about informing the public, information for consumers and workers. But as I already said, that's not enough. That's only if we've taken all the other provisions we can take for this for the safety, but then you, for example, for cleaning things also, you have to know that it shouldn't be at a place where children can get something like that. Therefore, information is also crucial. And to the aspect which experiences we have in Germany with the cooperation between the ministries. One thing is that at all the legislations we do, we always work together with all the ministries, because we when we take a decision, it has to be taken by the whole cabinet. Cabinet is it's all ministries in Germany, and there we often discuss intensely all the rules. But we also have quite specific cooperation with our ministry and the Ministry of Labor. For example, we are working together on sustainable production and use and processing of chemicals. And here the agencies for the environment and the agency for occupational health work closely together, and they are developing guidelines, criteria for sustainable chemistries, indicators, and so on. And this is a regularly cooperation between these two agencies, and one is the agency in the field of our ministry, and the other one is in the field of the Ministry of Labor. I hope that we will really endorse decisions on Friday, and that will strengthen the accountability of individual stakeholders and improve cooperation among stakeholders to ensure implementation. Therefore, also the inclusion of all stakeholders in this process is very, very important. And so yes, I think that all of us will also take these decisions in our daily action afterwards. So it's really the basis of the work we are doing. Thank you.
Thank you so much for giving those insights and for setting a good example and even joining this conversation. Hopefully, because as you're saying, speaking, I'm thinking yes, decisions are important, but also financing that comes with the action that is required, and then the sustainability, accountability that you mentioned as well is very important. So it is a lot about having the means to implement all these preventative structures, management systems, risk assessment, in addition to the knowledge and competence that we need at the national level. I'd like to give the time for everyone with us to have the chance to ask questions or make comments and remarks based on your national context or questions to our panelists. The floor is open, but maybe I can ask Baskut, if you'd like to give us a few words from the human rights perspective and your experience, or promote anything particular moving forward. I think there's a microphone. We can get to you.
Thanks, Manal. So my name is Bashkut Tunjak. I had the honor and the privilege of serving as the UN Special Rapporteur on Human Rights and Hazardous Substances for 6 years, from 2014 to 2020. First, I guess I want to congratulate ILO on having occupational safety and health finally recognized as a fundamental right and principle of the organization. I think it'll be transformative. I think it'll be very important, and I'm really looking forward to seeing what happens in the coming years as a result of this. So I guess maybe I didn't prepare any remarks, obviously, but just to maybe recap a bit of what I saw as a rapporteur. As a rapporteur, I undertook country visits, and I would often visit countries ranging from the highest economic levels to the lowest economic levels. And among all of these countries, what I saw was a very troubling picture of workers who are facing very grave exposures at work to, as was said, preventable and predictable hazardous exposures. And as you know, as someone who's coming from the human rights lens and the human rights perspective, we tend to focus on issues of discrimination and discriminatory practices. And what I was seeing was standards that were set where workers were permitted or accepted or allowed to be exposed to exposures that would never be allowed to ordinary folks in the environment. Exposures that were never health-based, never permissible under environmental standards were fine when it came to workers. And that is deeply problematic. That was not only a domestic practice, but it was also an international practice regarding the export of substances that were prohibited from being used by workers domestically, but were exported for use by workers in oftentimes low and middle income countries. And so when I looked back at several missions and saw this pattern emerging, I tried to focus more and more on the plight of workers. And in 2019, in collaboration with the ILO and WHO and trade unions and other stakeholders, I released a set of principles that focused on 3 themes or pillars. And one was prevention, the other was information, and the third was access to justice and accountability. And I was quite pleased that the Human Rights Council endorsed those principles and encouraged states and businesses to implement those. And just wanted to bring that back to the attention of this group, because perhaps that might be another avenue to help reinforce or strengthen the efforts around the fundamental principle that is occupational safety and health. So, thank you.
Thank you so much. Thank you. Well, that exactly with us to share that experience that you've had over this number of years. Who from the floor would like to either ask a question or share information? Musa from Kenya, Head of Occupational Safety and Health, please go ahead.
Good evening, and I would like to thank you for this meeting and for the very elaborate presentation, especially the presentation from Japan. Presentation that is actually led with a lot of information and a very systematic method of identification and dealing with chemicals. My name is Musa Nyandusi. I come from Kenya. I serve as the head of Occupational Safety and Health in the Ministry of Labor. And I would like to just make a few reflections. And my first reflection is in the nature of organization of work. And as opposed to Japan, where I would guess you would have clarity of the formalization of work, our setting and the setting of most developing countries would be that majority of workers would be working in the informal setting. We have a legislation, the Occupational Safety and Health Act, which has an entire section that deals with chemical safety. And it deals with handling, material safety data sheets, training, information, labeling, and all that. It further has an instrument called the Hazardous Substances Rules, which we enacted in 2007, and which also essentially goes ahead to give more detail to this, as well as prescribes occupational exposure limits for specified chemicals. The fact of the matter is that only about 18% of our workforce works in what you call formal setting. Over 80% of our workforce would work in settings which would otherwise be called informal. In these settings, there are settings where people work in their own farms. 40% of our people working in agriculture and getting a lot of exposure to chemicals. These chemicals are easily accessible. They are used without information, used without training. And obviously, we are experiencing a huge number of the cancer burden in some of our institutions. Where is the mechanism of us being able to link this it's difficult. And this is why I'm coming. This is the first time I'm participating in the ICCM. I'm seeing we have ICCM5. This is the first time I'm participating. It magnifies the critical role why different agencies need to collaborate in dealing with an issue. And if we are talking about chemical safety, if we have all these programs in the workplace that are anticipated to be intervening on issues of chemical safety, it would be in order that I will be getting information from the primary healthcare setting in terms of the persons who get affected from chemical safety, which would in turn inform the kind of interventions from a policy level, budget level that can actually influence the same. Be the same if we could have the same information from the Environment Ministry about what chemicals are coming in, what workplaces, in which case then we can have a more coherent interaction about the same. Like I said, these are reflections, and obviously we have an average of 800,000 people who get into the job market every year. Most of them are different stages of education. Some who get out of primary education who are underage and who will obviously get into the workplace right away, and will get into the settings in which they are going to be exposed to chemicals. And they're going to encounter the same scenarios of handling chemicals without information on their own safety, safe handling and disposal of the same chemicals. I think there's a critical discussion and a critical challenge to the leadership that is there today in how we can harness the different synergies to be able to coherently deal with the issues of chemical safety in the workplace, in the environment, in the health. So we have one harmonized process that allows us to see one another in this battlefield we are calling chemical safety. I think for safety and health, for us, it extends to even other areas, machinery safety, biological safety and the rest. But in this setting, obviously the chemical safety is critical for most of us. I hope someday we will have the kind of data where ICO was sharing about the cases that are there. It's sometimes difficult to assign cancer to a specific outcome, but we can make best case scenario. CA cervix, CA tribe, maybe HPV, possibly the lung cancer is a bit of smoke. It's a multi-causative issue, but it's true that we see a higher incidence among workers than people who are not at work, which actually presupposes that there must be an occupational exposure. So what do I look forward to? I look forward to a statement that recognizes the importance of having a multi-pronged approach in handling issues such as chemical safety, and I hope in other settings as well, that allow us to set out first international programs that recognize this, that can percolate down into the national programs that allow us to logically be able to deal with the issues that affect us in a way that it can be impactful to workers. Thank you. Thank you very much.
Very happy to hear your reflections. Thank you so much for sharing them with us. I wonder if anyone else would like to take the floor. South Africa, please.
Thank you. Apologies for my voice. So just reflections also from South Africa. If you look at in South Africa, we have a burden of unemployment of about 32% of the population of South Africa, which is just over 60 million is unemployed. And a lot of those people are working also in the informal sector, some form of informal sector. And I also would like to share the sentiments of Kenya. If we look at South Africa, we have a lot of fragmentation, and that is one of the challenges that we have when it comes to chemical, not only safety, but health-related matters, where you find that there's the Ministry of Environment. I work for the Ministry of Employment and Labour, responsible for occupational health and safety. We have, for instance, a Hazardous Substances Act that falls under the Ministry of Health, where they also deal with some form of chemicals as well as cosmetics. Then if you look at, for instance, mining, there is work that's done underground. They have their own inspectorate that also deals with, some of the chemicals that they utilize underneath the ground. I'm not sure if everybody's experiencing the same, but we are a developing country. So there's a lot of fragmentation. And for instance, the Ministry of Environment from South Africa is here. I'm here because the ILO, I'm using it as an example, the ILO invited us as the Ministry of Labour, and it's the only reason why we are here. Otherwise, we would not have even known about it. We've never been part of the ICC. And a big portion of our more than 60 million population work and they're exposed to chemicals. The chemical sector makes up 4% of the GDP of South Africa. And manufacturing is one of the biggest portions of our economy. And 23% of manufacturing is chemical in South Africa. So I think for me, what is important is that, like Kenya said, we need to find a way of working together. I think Rory, is his name Rory, also spoke about it, or that he's from labor and sometimes we get excluded, or when we as labor, like for instance, we have now incorporated GHS in our legislation, but it's not GHS in totality. The Department of Health, as well as the Ministry of Environment, etc., they also need to do their part. So I think it's important that we need to be able to work together and to identify that hazardous chemical substances is not only related to the environment, but there are so many other aspects of it. And when we come up with solutions and declarations, it should look at it holistically. Thank you.
Thank you so much. It's a bit late in the process, but at least we're starting to hear some voices from our neighbor constituents. Thank you for speaking up. Would anyone else like to take the floor? I'd like to take this opportunity to thank our technical specialist and coordinator of the chemicals program, Halshka Grazik, who's here. She's been in contact with many of you to join, and she's also behind the success of making sure that our labor sector is here, along with a number of colleagues from the team. We have Andreas Hobel, who's been helping out a lot. Andreas, raise your hand. And Natasha Scott, Lacey Groening, they're separated in different rooms trying to catch up with a lot of the work and the support of the branch chief who's joined us in this ICCM5. So I'd like to thank you all for being here. Wonderful panelists, very intriguing, inspiring work, and just so much to do for the future. So we're very passionate to continue and to collaborate together. Thank you so much for joining us. So we have some drinks and food right outside the door as well. See you there.